What is Ocrevus? Ocrevus ocrelizumab is a monoclonal antibody treatment for relapsing and progressive multiple sclerosis MS to help reduce relapses and slow disability progression. Ocrevus is given an infusion over a couple of hours. Ocrevus Xenovo is given as an injection under the skin subcutaneous injection for approximately 10 minutes. Both are given twice a year as a maintenance dose by your healthcare professional. It's not known exactly how Ocrevus works in people with MS, but it targets and binds to B cells expressing CD20 on their surface, which results in their destruction via antibody-dependent cellular cytolysis and complement-mediated lysis. B cells are a type of white blood cell that contributes to the development and ongoing disease process involved in MS in a number of ways. The CD20 antigen is mainly found on the surface of B cells, which are also known as B lymphocytes, making it a good target for MS and certain other conditions affecting B cells. Ocrevus Xenovo became FDA approved on September 13, 2024. And Ocrevus was approved by the U.S. Food and Drug Administration FDA in March 2017. What is Ocrevus used for? Ocrevus and Ocrevus Xenovo is a prescription medicine approved by the FDA to treat relapsing forms of MS, including clinically isolated syndrome, relapsing remitting disease, and active secondary progressive disease in adults. Primary progressive MS in adults. It is not known if it is safe and effective in children. Ocrevus side effects. Ocrevus may cause serious side effects, including, see what is the most important information I should know about Ocrevus. Above, risk of cancers, malignancies including breast cancer. Follow your healthcare provider's instructions about standard screening guidelines for breast cancer. Inflammation of the colon or colitis. Tell your healthcare provider if you have any symptoms of colitis, such as diarrhea, loose stools, or more frequent bowel movements than usual, stools that are black, tarry, sticky, or have blood or mucus, severe stomach area, abdomen pain, or tenderness. Important information. Ocrevus can cause serious side effects, including infusion reactions. Infusion reactions are a common side effect of this medication, which can be serious and may require you to be hospitalized. You will be monitored during your infusion and for at least 1 hour after each infusion for signs and symptoms of an infusion reaction. Who should not receive Ocrevus? Do not receive this medication if you have an active hepatitis B virus HBV infection. Do not receive this medication if you have had a life-threatening allergic reaction to it. Tell your healthcare provider if you have had an allergic reaction to Ocrevus or any of its ingredients in the past. How should I receive Ocrevus? Ocrevus is given through a needle placed in your vein, intravenous IV infusion in your arm. Before treatment, your healthcare provider will give you a corticosteroid medicine and an antihistamine to help reduce infusion reactions, make them less frequent and less severe. You may also receive other medicines to help reduce infusion reactions. See what is the most important information to know about Ocrevus. Your first full dose of Ocrevus will be given as 2 separate infusions, 2 weeks apart. Each infusion will last about 2 hours and 30 minutes. Your next doses of this medication will be given as 1 infusion every 6 months. These infusions will last about 2 hours to 3 hours and 30 minutes depending on the infusion rate prescribed by your healthcare provider. Dosing information. Recommended Ocrevus dose, starting dose, 300 milligrams for infusion. Followed 2 weeks later by a second 300 milligrams for infusion. Subsequent doses, 600 milligrams for infusion every 6 months. Recommended Ocrevus Xenovo dose is 920 milligrams, 23,000 units, 920 milligrams ocrelizumab, and 23,000 units of hyaluronidase administered as a single 23 milliliters subcutaneous injection in the abdomen over approximately 10 minutes every 6 months.